Do you suffer from unexplained weight gain or weight loss? Do you experience anxiety, mood swings, memory loss, tiredness, or hair loss? These are all signs and symptoms of a possible thyroid problem. In just a few minutes, I'm going to explain what the thyroid is, explain what happens when the thyroid is not well, and explain how to test for thyroid problems and treat them when necessary. My facts are based on medical magazine articles, credible websites, and the interviews of several medical doctors. Now, the thyroid is a small butterfly-shaped gland located in the front of the neck. It is part of a group of organs and tissues known as the endocrine system that produce, store, and secrete hormones directly into the bloodstream. The thyroid consists of many little sacs filled with fluid called thyroid hormones, which contain nearly 80% of the iodine found in our entire body. Now, a dietary deficiency of this element could lead to an enlarged thyroid or goiter. In young children, a lack of iodine can inhibit hormone production and thereby retard physical, mental, and sexual development. When the thyroid produces too much hormone, the body uses energy faster than it should. This condition is called hyperthyroidism. Now, symptoms would include excessive agitation, unexplained weight loss, rapid heartbeat, increased in bowel movements, irregular menstrual periods, irritability, anxiety, mood swings, protruding eyeballs, muscular weakness, insomnia, and thin, brittle hair. Now, when the thyroid doesn't produce enough hormone, the body uses energy slower than it should. This is called hypothyroidism. Now, symptoms for that include physical and mental sluggishness, unexplained weight gain, hair loss, constipation, exaggerated sensitivity to cold, irregular menstrual periods, depression, voice change, memory loss, and tiredness. If you suspect that you have a thyroid problem, consult your doctor. Do not try to treat it yourself. Currently, about 20 million Americans have some form of thyroid disease. People of all ages and races get thyroid disease. However, women are 5 to 8 times more likely than men to have thyroid problems. And according to Dr. Hossein Garab, MD of the Medical Association of Clinical Endocrinology and professor of Mayo Medical School, quote, he says, 50% of thyroid disease patients' offspring will inherit the thyroid disease gene. Now, although opinions vary greatly as to how often you should be tested for thyroid disease, it is usually ordered at least once a year by your doctor at your yearly physical. Screening for newborns is generally felt to be important by most doctors. Testing is done through a simple blood test. If blood tests reveal a problem, physicians can take corrective measures. Treatment options vary greatly depending on the severity of your thyroid condition. Many times it can be treated with a medication, which will also help ease the symptoms such as accelerated heartbeat, muscle tremors, anxiety. Other treatment options include destruction of thyroid cells so that the gland produces less hormones. And sometimes the thyroid may need to be surgically removed. Nonetheless, a diet rich in wholesome foods that contain sufficient iodine, which would include seafood and saltwater fish, Also, avoidance of stress and doing your best to maintain overall good health are all important factors in keeping your thyroid healthy. So we see how our thyroid affects our ability to carry out normal everyday tasks. Now, will you take the time to care for your thyroid and check for possible thyroid problems with a simple blood test? Thank you all for your time.